My name's Ian McDermott. I'm a knee surgeon here in London. And I work closely with Nell because I think she's absolutely great. So we share lots of patients, especially the really difficult, complicated ones. When it comes to knee replacement, it's terribly important that the patient is optimised as best as possible before any surgery. So with the knee replacements that I do, which are custom made, the patient has a 6-week window where it takes time for the prosthesis to be designed, manufactured, and then delivered to us, ready for implantation. That 6 weeks is invaluable. That gives the patient time to do their prehab. In other words, to get into the best possible shape they can ahead of their surgery. The fitter they are, the stronger they are, the better they'll cope with the operation, the better they cope with the post-op rehab afterwards, and the better their outcome is likely to be. So prehab is critical. And that's for patients in the private sector who get their surgery quickly. Unfortunately, in the NHS, where there's extended waiting lists like 1 or 2 years or even longer, then the prehab is even more important. There's lots of ways that a physiotherapist can actually assist you in keeping yourself going for longer during that waiting period and helping you to cope. So I can't recommend prehab, the whole concept of prehab, strongly enough, and strongly endorse Nell's prehab program, and hopefully as many patients as possible will see this and follow it.